afternoon, everybody. We have the pleasure of being the very first session after lunch, and we carb loaded. So let's hope we keep this exciting and everybody is energized by our session. Before we dive in, I wanted to ask everyone a question. What gives you inspiration? And you can shout it out. This is energy building. We said after lunch, so you can scream it out. What gives you inspiration? I like it. Good challenge.
Yeah.
Grandkids, I love that. Pictures are welcome too later. Like it. Oh, Amy Purdy. She truly was inspirational. What an amazing session and a great reminder of, again, when a challenge presents itself, there's always opportunity. Personally, a lot of my inspiration comes from my two boys, who are 5 and 8. And if your household is anything like my household, you can guess who owns the remote control to the TV. It's them. And I often find myself watching many of their kids' shows. A favorite of theirs is called Stinky and Dirty. So for those of you in the audience perhaps not familiar with Stinky and Dirty, Stinky is appropriately a garbage truck, and Dirty is a backhoe. And the two are friends who find themselves in very tricky and unexpected situations. Things like a boulder in an intersection, or a bridge washed out, or a playground that collapses. And each time they look at each other and they ask a very simple yet powerful question. What if? What if we pushed the boulder? What if we try to roll the boulder? What if we try to get additional friends to come and lift and move the boulder? And so, looking across this room, I would ask all of you, what if we could remove that boulder in your day? What if you could meaningfully reduce denials? What if your staffing model could dynamically adjust to demand? What if you could keep patients healthier and keep your staff happier? It's pretty amazing to take that step back and just think for a moment, what if? And if you look around this room, you're surrounded by experts. Experts in healthcare, technology innovators, business leaders, and we all are a vast set of experiences. And those experiences and lessons learned create opportunities. And our ability, when you combine those experiences together to create impactful change, is exponential. And so I'm super fortunate to be joined by a panel of experts who are going to talk to you today about some of those what-if moments, and not just the what-if in theory, but the what-if that they're applying in their everyday. So with that, I'm going to first turn to Sudha, who, and I should probably advance the slides so you know who everybody is. I thought we were just going to let you all guess. That would be really fun, keep you on your toes after lunch, like I said. You didn't know you were participating in our panel today. But Sudha, as a product leader at Brightree, you are often, presented with unique challenges in your everyday scenario. And I'd love to hear from your perspective, what role does partnership and technology play in helping healthcare orgs make that leap from that what-if kind of scenario to have high impact?
Yeah, definitely. So in the couple of sessions in the morning, we had your CEO and we had the talk focused more on the patient journey and the patient workflow. So I would probably start off with the most important persona in the healthcare system, which is a patient. The patient journey has changed, or the patient expectations have changed over the past few years. There is probably no person in United States who did not place an order from Amazon. We can probably confidently say that. So every patient now has an expectation of an Amazon-like experience when they come to healthcare as well. So they want transparency. They want to set expectations on what care is, what they could expect. They want to be in control of their scheduling mechanism. They want to have complete transparency on their financial liability or financial responsibility. So at Brightree, we do a lot of niche things. We serve the post-acute care industry, but there are certain areas that we don't often get into. So we take advantage of the partners and the partners like you who bring your value into our ecosystem, and we partner closely on some of the aspects that we can take advantage of, but still focus completely on the niche service we provide for our customers. So I think the silos on how patient gets treated today in the ecosystem needs to be brought down a little bit, and it needs to be presented more integrated for the patient, where it seems more a smooth journey for them because they are undergoing a certain life-changing event possibly in their journey. And we want to make sure that neither technology nor the process or whatever impediments that they perceive as part of the journey should not be painful, and it should be a very much smoother and much seamless for them. So that's how I think absolutely technology and partners like you should come in, and they would make a great impact on platforms like us.
And it's such a great example, right? Because I think oftentimes, in life, at work, a challenge presents and you think, okay, I need to sit down. I need to solve this. I need to do this. And I love what you just said, because it's really focused on kind of the partnership, right? How different entities coming together and different ideas really have the power to, do something incredibly unique.
Yeah, absolutely. And thinking of patient as an afterthought in the entire process, in the entire workflow journey, would cause more friction in the process rather than developing your solutions, developing your workflows and your approach with a patient-centric approach would have phenomenal positive results. Because trust me, all of us at one point were or would be a patient tomorrow. Yeah. So when I come to office every day, when I speak, this is a future that we are possibly building for ourselves on how smooth the healthcare system needs to be when we are in that position. So absolute investment needs to be made on technology, and more so on building seamless and frictionless environments.
And I'm glad that you bring this point up, Sudha, especially when you talk about the Amazon-like interaction and putting the patient in the center. We are continuing to hear from the market, from our research, from our data, that not only do we need these experiences for the patient, but our revenue cycle leaders, the billers, the staff that working with the residents or the patients, everyone needs this type of technology. And we put big investment on our UI and UX so that we can help with that. And I love the parallel to putting the patient in the center and also the Amazon-like experience.
True.
So true. I always say you need to make the workflow work for the user, right? It sounds so simple, play on words. Work for the workflow. But simplicity in workflows can really transform and separate organizations who are just working so much more efficiently. And again, we talked a lot this morning, you heard Adam talk about staff burnout, right? A great way to increase burnout is to make it really complicated and hard. So that brings me to another question, Liz, since you brought up workflow. With your expertise in revenue cycle management, where are you seeing automation create the biggest impact, and especially into the workflow?
So 2 things come to mind. And first, I'll start with the eligibility verification process. Today, it's still a pretty manual process to find all the insurance coverage for patients, and it often will create that friction between the front end of the revenue cycle and the back end of revenue cycle. Our research is showing that we continue to see 25% of the claims denied are due to front-end issues. I know we've been hearing stories all morning, but this one's just a little different, but I'll tell you just a personal story. Last year, I received a medical bill in the mail, and this one looked just a little different. I have good insurance, and I was scanning it. It was a couple $1,000, and I thought that was odd. So I took a closer look, and they ran it under very old insurance. It was actually when I had my maiden name and my old insurance that they must have had on file. So I had to make the phone call, talk to the biller, enter my insurance. Weeks later, I received the appropriate bill, and I'm assuming they were able to adjudicate the claim and get their reimbursement, but that is a long and inefficient revenue cycle process. Also, as Sudha mentioned, putting the patient in the center, it's a little intimidating getting a large unexpected bill in that situation and then having to make the phone call to correct that. So we can automate this whole process on the front end through our data and solutions in one click or in one process. As we look to streamline that technology, we can return the accurate and up-to-date information and benefits for the patient. So getting really kind of detailed and specific, as a lot of you guys are CM hats on here in the audience, but we can find the MBI, Medicare Beneficiary Identifier. We can find the primary, secondary, and tertiary coverage with the specific service types for the procedure they're having. We are able to validate demographics. If we can't find the insurance, we can run through our discovery, but all in one process. So gone are the days where we have to search or look to see if a resident had a change of coverage. Now we can do all of that in one, and we'll configure it so it's most efficient and we're not always trying to just go run discovery on the patient.
Yeah. If I can add one example there. So the what if scenario that you said, what if your patients walked in with an old insurance and you are not able to run eligibility for that because it's either not present or you're getting a negative result? But your systems are now capable of discovering what the potential future insurance is, that you do not have to go back to the patient or have them call their spouse, who may be the primary coverage for that, and asking, what is my insurance? So that's an experience that surprisingly looks very minimal for us, but it's a huge impact because they're probably at the pharmacist or at the medical office trying to have a service rendered and they're getting a negative result. But there are automations and systems in place, insurance discovery that you just called out, which could have a huge impact on the patient experience at that very moment.
Yep, absolutely. The second one that comes to mind is being able to predict a claim is going to be denied before it goes out the door. And I know Adam made reference to this earlier this morning, but this process is really cool because you're able to surface up the reason that it's going to be denied for that biller, so they know exactly what to go and look at, and then they can figure out what change they need to make before they send that claim through. So that process becomes super efficient, higher first pass yield, your claim will get paid. When we think of the example to tie it together that I said just with my old insurance being used, that would have been flagged and they would have been able to predict the denial, fix the information, and then send it through. So we're just getting more and more efficient. And as most of you know, who potentially use our claims tools, we can scrub through our standard and custom business rules first, and then layer in that prediction. Again, the whole plan is to use that intelligence, use that automation, and stop that claim before it goes out the door, and have that human know they need to fix something and where they should focus on so that they can have the whole efficient revenue cycle process.
I love it. I love it. And, we've been talking a lot about some examples within the revenue cycle where we're asking that, kind of what if question. So Andrew, you're on the hot seat now. Andrew, as an expert from the workforce side, how are you seeing, or what are you seeing as kind of that next step for, leaders and how they're thinking about driving predictability into the workforce?
Yeah,
staffing.
Really, really good question. And I would say in terms of that next step from a workforce management perspective, we're looking at leveraging AI as a technology, or maybe more importantly, as a tool that we would use to build better support for healthcare workers. And I say that very specifically because I look at healthcare workers and the environment where they're working today. And if you just look at some of the metrics that, represent these, workers, it's around staff shortages. And that's significant in healthcare, as I'm sure all of you know. Turnover. When you've got turnover in your organization at 23% in the healthcare industry, I mean, that's double what, the average is within the industry. Burnout. I feel like we've talked about burnout for, I don't know, it feels like decades now. I mean, years we've talked about burnout, and it resurfaces year after year. And so, finishing with attrition, where you're losing some of those long-term employees within your organization, when you look at that environment, I can't imagine a group of workers that needs more technology capabilities to allow them to work smarter, not harder. They're working very hard, and I think that's where we lean in from an Inovalon perspective, is that we're working in conjunction with our customers to really incorporate AI into our solutions to really address schedule disruptions. That's sort of a starting point for us in terms of workflow management. So, given that quick backdrop, I just kind of wanted to give a scenario to kind of explain when I say schedule disruption, what am I talking about? And the scenario, we hear it from our customers. We heard it in a recent American Hospital Association roundtable discussion, which Carly, you were a part of. And so I'm going to work you into my scenario here. But essentially, the scenario goes something like this: schedule disruptions are all about like Nurse Carly, who is calling in and calling in sick for her shift. It's the middle of the day, and it's a few hours, before that shift starts, and it's nobody's fault. It happens, right? People get ill, and while all that's true, for me as Carly's manager, the clock is ticking for me. I've got shifts that I need to fill Carly's shift. And so what's next? I've got to, call and text and email out to my staff to find coverage. I quickly learned that my staff is tapped out. They've been, working late hours, working overtime. And so what do I end up doing? I call out to an agency, and I bring in an agency worker to cover that shift. At what cost to the organization, though? I mean, an agency worker being, sometimes 3 times the wage that an internal person would be. And so, when you focus on that, there's a lot of direct costs associated, but there's a bunch of indirect costs in that scenario as well, where administrative time of your staff that's got to rework the schedule, that kind of thing, overtime that may need to be used, and potential negative impacts on patient care, where things like continuity and team dynamics of your internal resources, when you bring that external person in, that's a potential issue. And so, when you look at that scenario and you, kind of multiply it by the fact that I called out one scenario where, Carly calls in sick. But if you're a large organization and you've got dozens of units and maybe hundreds of nurses that are working on those units, and thousands of shifts that are created on a monthly basis, you can see how that cost and frustration compounds rapidly. And so I wanted to compare and contrast that really quick, because this is my what if slide, right? So when you compare that scenario I just provided to you with essentially where we're going with our product set and the use of AI and technology, if you what do you end up doing in that situation where essentially you're looking for a way to forecast staff availability? And so I ask you to kind of imagine this alternate scenario where the scheduling team comes in on a Monday morning. They open up their dashboard and they see all the shifts that are scheduled for that week. Alongside that shift, you see an indicator. I'm gonna refer to that as a call-out risk score. That score is calculated with data within your organization. It's things like the time of day that shift is scheduled, the department. Are these resources, is this their home location, or were they floated into this shift in a department? Are there seasonality issues, recent overtime? What about fatigue levels in the department? Using all of that data to flag individual shifts as high risk is where, then the system will jump in and suggest intervention. And that intervention could be no cost interventions like automated announcements out to your staff as to who might be willing to work, or it might be on-call strategies where, one or two nurses are compensated to remain, on standby for this shift. And yes, you're paying a little bit more in that situation, but it's a fraction of the cost in terms of that agency scenario that I provided.
So, Andrew, if I can humanize the example that you just said here, right? I think the modern workforce today is also looking for a very well-balanced work and after work life where they're trying to have more control on how they can work and how they can balance their home situation. The example where you said if you were working in a hospital-like setting and you have a soccer game at 5 o'clock and your shift ends at 4 o'clock, you probably want to end it and get to your kids' game, which is a reality for most of you. So for any nurses or schedulers in the house, if you raise your hand, I want to just have a context of that scenario. So just imagine you're scheduling a new patient at 3:30 on a Friday afternoon. You know for a fact that's not going to go very well because it's going to be it's not a 30-minute session. It's definitely going to be a 45, 60-minute session. So I think the AI that you're building definitely shapes in to contribute more to how transparent it could be both for the organizations and for the individuals to plan a better work-life balance and reduce that risk on, I have to go volunteer for a particular activity. Can I put in? Can I not put in? Can you help me be more predictive and transparent in the prediction of schedules? So just a thought from our workforce, just humanizing the workforce in there.
Sudha, I couldn't agree more. I mean, I guess I look at the highest level. I look at the benefits of, kind of this building of a safety net as being beneficial to the staff, to the individual work, like for all the reasons you just called out, but also beneficial to the healthcare organization. We reached out to one of our customers and looked at the spend. Take a look at a year's worth of call-off situation and how much premium pay had to be allocated to, that's overtime or as I mentioned, the agency workers, just shy of like $28 million. So anything that you can do to kind of pull that, reduce that spend at an organization is beneficial for the business as well.
Entire business and organization. True.
Right.
Yep.
Well, and don't forget the patients, right? I mean, I think often I was going to say Nurse Carly was probably getting called out because she caught something from her kids. We love them, but they are Petri dishes. But I mean, that's the other side. If you're caring for a loved one and, it's incredibly difficult to even get that appointment. And then if that appointment all of a sudden were to, worst case scenario, be canceled. Oh, you've got to reschedule. You've got to find another time. And you're either caring for yourself or someone in your family. That can lead to a lot of stress, a lot of anxiety. And then what happens if that condition worsens? And so, it's the staff providing the care. It's the organization trying to manage the cost to keep their doors open. And it's the patients who are, they're the ones in need. And so that triangle, if we get it right and, we experiment and find that way to get more predictive, I mean, everybody in that triangle is winning.
Absolutely. I mean, most of us are surprised when we don't have a regular nurse or a regular provider when we go in. And I think the patient experience definitely weighs in very heavy in this prediction model.
Agreed. So let's take that to next level. Let's ask another what if question. What if you could take some of that staffing and that insight into the staff needed and combine that with Acuity insights and think about what if we could make sure that we're always aligning the right level of staff and the right credential of a nurse to the acuity of the patient. That's another area where, hey, you're pinch hitting, you're having to take on an extra shift, but the acuity of the patient, is that actually aligned to the caregiver who is available at that time or pinch hitting in a scenario where a shift had to open up and they had to step in? Now, what does that mean for the patient, right? Are we confident that the level of care that's going to that patient is the right level of care? And so if you think about how predictions can go into kind of a modified early warning system, right? That, again, maybe the patient in that moment isn't at a higher acuity, but could be moving towards that. How do you staff appropriately, knowing and understanding? And the beauty is, I mean, again, we're going to go back to, we have the data, right? We have all the information about the patient's health, and we have the information about the staff. What if it were combined? What if those two predictions were coming together, raising the level of care being delivered to the patient, raising the satisfaction of the staff, raising, or not raising, but stabilizing costs and keeping costs neutral for the organization? There's so much potential to untap in that predictions. And if we take that a step further, right, go beyond kind of the staff, I heard a couple of murmurs in the audience this morning when Adam presented that slide that said 97% of data goes unused. 97%. I mean, is there another, I don't know if there's another industry that has that kind of an astonishing stat. And a lot of that comes from that data is unstructured. And that unstructured data, especially in a care setting, is so incredibly rich in information. And so starting to think about predictive models using natural language processing to really harness that data, that unstructured text, derive those insights and infuse that into a care plan for a patient. I mean, the possibilities are endless, right? That 97% starts to really quickly diminish into something that, wow, you're now building action, right? You're building action into that patient's care plan and making a significant impact. And I think, I've heard it so many times, and I don't know if Michelle Spurlock is in here, but in past years, she said, like, when you're a nurse, you're getting into healthcare for the purpose of caring for patients, right? And so much of the time, the operational burdens all around you, the administrative burdens end up consuming you and taking that joy that's leading to that burnout that we've all been talking about today. And so really starting to think about that world where the focus is back on the patient, the focus is back on doing what clinicians love, and that's providing care to patients. So I think the predictiveness, the data, the opportunities, and what we can do are so significant.
Absolutely. And I think the healthcare providers, when they're driving into work every day, they probably do not envision themselves being on the phone with payers for 2 hours on trying to get prior auth, or sitting down and filling documentation for 4 hours. So I think there is a huge opportunity for us to change that kind of, I would call it necessary evil, where I wouldn't discount the importance of documentation or the necessary process that health plans and organizations mandate us. But wherever there is an opportunity, sorry.
Oh,
Glad you did it first.
Somebody had to do it. So wherever there is opportunity for us to enhance and build automation with intelligence to minimize these manual tasks and provide the opportunity for providers to have more empathy, more time for empathy, more patient care, more meaningful tasks that they can perform, I think that would be a win, a huge win. And I think the customers, the market, the industry is definitely looking at us and partners like you to start building products and bring that innovation to the market.
Yeah. Carly, I just wanted to jump on the comment you were making, because I thought of, kind of the concept of it's all about supply and demand. And so as I was kind of sharing where we were going with the use of AI in our product, it's around supply, making sure that we've got the right resources at the right time for the patient. And from your perspective, it's all about the demand side of things, right? So if we know that the patient load is coming in and the acuity is high, we got to know that in terms of, that's the demand for resources. So we think about that within our schedule management solution as kind of from both sides, the supply and the demand.
Sure.
Love it.
Good.
So I'm gonna bring us back to where we started. You also didn't know you get homework if you came to this session. You're all gonna go home and watch an episode of Stinky and Dirty now, because you're gonna reach for that inspiration. You can thank me later and then ask why did I watch that? No, it's actually wonderful. But as we close out our time, I do want to bring us back to that very simple yet very powerful question, which is, what if? And I hope that, hearing from some of our experts today, you got a little taste of the what if, and how you can start to think about the what ifs. And again, through partners, it's not just thinking about the what ifs, in your role or in the problem that is just in front of you or your team, but really looking all around you to other experts and saying, what if? So as you head into the rest of Empower, and you attend many more sessions and hear from many experts, or have the opportunity as we network or get with puppies later, I think this afternoon, I would encourage all of you to ask that simple question. What if we tried this? What if we collaborated with someone, maybe a health system down the road or geographically? What if we did it together, right? The possibilities are endless. And so I would encourage everybody to take away the energy, the ideation, the innovation, and think about that triangle. You've got the staff providing care. You've got the health organization thinking about, how do I keep the operations running so I can deliver care? And you've got the patients and the people who are supporting patients in their care journey. So, what if? And with that, we will, I think, turn this up. Please give feedback. I know the marketing team will tell me. Please, you can scan the QR code. We very much appreciate your feedback and appreciate all of you spending some time with us today.
Thank you.
Thank you.